Hi. Welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the access to care and continuity of care, ACC.
What is the process in transferring patient to other unit, intra-hospital transfer?
Transferring a patient to another unit within the same hospital, intra-hospital transfer, involves several coordinated steps to ensure the continuity of care, patient safety, and effective communication between healthcare teams. Here's a general outline of the process. 1. Assessment and decision to transfer. Clinical evaluation. The patient's current condition is evaluated by the attending physician or healthcare team to determine if a transfer to another unit is necessary. This might be due to changes in the patient's condition, e.g., improvement, deterioration, need for specialized care, or operational needs, e.g., bed availability, appropriate level of care. Decision to transfer. Once the need for transfer is identified, the attending physician authorizes the transfer. The decision should be documented in the patient's medical record, including the rationale for the transfer. 2. Preparation for transfer. Communication with receiving unit. The transferring unit's nurse or physician contacts the receiving unit to provide a verbal handover. This includes the patient's medical condition, reason for transfer, current treatment, and any specific needs. The receiving unit confirms the availability of a bed and readiness to receive the patient. Documentation and orders. The physician updates the patient's orders to reflect the change in location and any adjustments to the care plan needed after the transfer. The patient's medical records, including recent notes, medication lists, and test results, are updated and prepared for transfer. Patient and family notification. The patient and their family are informed about the reason for the transfer, where the patient is being moved, and what to expect. This communication should be clear and provide an opportunity for any questions to be addressed. 3. Transport and handover. Patient preparation. The patient is prepared for transfer by ensuring they are stable and that all necessary monitoring equipment, medications, and personal items are ready for transport. Vital signs are taken, and any necessary medical interventions are performed before transport. Safe transport. The patient is transported to the new unit by appropriate personnel, such as a nurse or transport team. Depending on the patient's condition, they may require continuous monitoring or support during transport, e.g., portable oxygen, for fluids. If the patient requires special handling, e.g., in the case of critically ill patients, a nurse or other healthcare provider may accompany them during the transfer. Verbal handover. Upon arrival at the receiving unit, a verbal handover is conducted between the transferring and receiving nurses. This handover includes a summary of the patient's condition, recent changes, current medications, and any immediate care needs. The receiving nurse may ask questions or clarify information as needed to ensure a smooth transition. 4. Post-transfer care and documentation. Assessment in new unit. The receiving unit's nurse or healthcare provider performs an initial assessment of the patient upon arrival to evaluate their condition and confirm that the transfer was completed safely. Any new orders or care plans specific to the new unit are implemented. Documentation. The transfer is documented in the patient's medical record by both the transferring and receiving units. This includes details of the patient's condition before and after the transfer, the handover information, and any changes made to the care plan. Update care team. The care team in the new unit is updated on the patient's condition and care plan. This may involve notifying the primary care provider, specialists, and other relevant team members of the patient's new location. 5. Family communication and follow-up. Family update. The patient's family is informed once the transfer is complete and updated on the patient's condition in the new unit. Ongoing monitoring. The patient is closely monitored in the new unit to ensure that they are adjusting well and that their care needs are being met. If any issues arise post-transfer, they are addressed promptly by the receiving unit's healthcare team. Example scenario of intra-hospital transfer. Patient, Mary Johnson. Initial unit, ICU. Receiving unit, General Medical Unit. Reason for transfer. Patient's condition has stabilized following treatment for acute respiratory distress. The patient no longer requires intensive monitoring and is being transferred to a general medical unit for continued recovery. Preparation. Dr. Smith authorizes the transfer, noting the patient's stabilization and improved respiratory function. Nurse Jane contacts the receiving unit to confirm bed availability and provides a brief report on the patient's condition. The patient and her family are informed of the transfer and reassured that it is a positive step in her recovery. Transport. The patient is prepared for transfer, with portable oxygen provided during transport. Vital signs are stable. Nurse Jane and a transport team member accompany the patient to the general medical unit. A verbal handover is conducted with the receiving nurse, covering the patient's recent treatment, current status, and care needs. Post-transfer. Upon arrival, the receiving nurse conducts an initial assessment, confirms that the patient is stable, and implements any new orders. The transfer and all related information are documented in the patient's medical record. The family is updated, and the patient is monitored closely to ensure a smooth transition. Conclusion. By following this process, hospitals can ensure that intra-hospital transfers are conducted safely and efficiently, minimizing the risk of errors and ensuring that the patient receives continuous, high-quality care.